The first question people ask, is there any sugar in this? Or I don't want sugar. In this video, we will discuss about what is diabetes, what are the different types of diabetes, its symptoms and how can we prevent it. Namaste, this is Ashley. Welcome to Aaroga Belaku channel. We hear people telling, I don't eat sugar or sweets. I eat little rice, then how can I get diabetes? Why should I go for a checkup? Yes, it is true. Those who follow an unhealthy diet, your risk of diabetes is high. But it doesn't mean that you don't eat sugar or sweet, you will not get diabetes. There are other so many factors which produce diabetes. First, let us discuss about what is diabetes. What is diabetes? Diabetes is a disease in which your blood glucose level are too high. When you have diabetes, your body doesn't make enough insulin or can't use it as well as it should, or both. Too much glucose stays in your blood and does not reach your cells. Over time, having too much glucose in your blood can cause serious health problems. So, if you have diabetes, glucose level get too high which can lead to serious health problems. This include heart disease, nerve damage, heart problems and kidney disease. What is blood glucose? Blood glucose or blood sugar is the main sugar found in your blood. It is your body's primary source of energy. It comes from the food that you eat. Your body breaks down most of that food into glucose which goes up. It signals your pancreas to release insulin is a hormone that helps the glucose get into your cells to be used for energy. It's important to keep your blood glucose target within your target range. What are blood glucose targets? If you have diabetes, your blood glucose target is the range. You try to reach it as much as possible. The typical targets are before a meal 80 to 130 mgdl, 2 hours after the start of a meal less than 180 mgdl. Your blood glucose targets may be different depending on your age. If you have any additional health problems and other factors, talk with your doctor about the test target range for you. We have already discussed about diabetes. Now let us know the different types of diabetes. Type 1 diabetes. If you have type 1 diabetes, your body makes little or no insulin at all. This condition happens when your immune system attacks and destroys cells that produce insulin. It can develop at any age, but it is most often starts in childhood. People with type 1 diabetes must take daily dose of insulin by injections. Causes of type 1 diabetes. The immune system mistakenly attacks and destroys insulin producing beta cells in pancreas. You are more likely to get type 1 diabetes if you are a child or a teenager. Treatment of type 1 diabetes. Insulin is the main treatment for type 1 diabetes. It reproduces the hormone your body isn't able to produce. Type 2 diabetes. This is the most common form of diabetes. If you have type 2 diabetes, your body may still be able to make insulin, but the cells in your body do not respond well to the insulin and can't easily take up enough glucose from your blood. Type 2 diabetes may be caused by your genes and lifestyle factors such as being overweight or having obesity. This condition is more often occurs in adulthood, but it is becoming more common in children and teenagers. Causes of type 2 diabetes. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your body. It's the most common type. About 90 to 95% of people living with diabetes have type 2. Your risk for type 2 diabetes increases if you are overweight, if you are age 45 or above, have a parent or sibling with the same condition, if you aren't physically active, and if you have high blood pressure or high cholesterol. Treatment of type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes aren't enough to lower your blood sugar, you will need to take medications. Gestational diabetes is the high blood sugar during pregnancy. Gestational diabetes occurs as a result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant person's cell less sensitive to effect of insulin. This can cause high blood sugar during pregnancy. Causes of gestational diabetes. Unmanaged gestational diabetes can lead to the problems that affect both the mother and the child. Complications affecting the baby can include premature birth, higher than typical weight at birth, increased risk for the type 2 diabetes later in life, low blood sugar, jaundice and stillbirth. Treatment of gestational diabetes. If you have received a diagnosis of gestational diabetes, you will need to monitor your blood sugar levels several times per day during pregnancy. If it is high, dietary changes and exercises may be enough to bring it down. Prediabetes. This is a condition in which your blood glucose level are higher than normal but not high enough to be considered as diabetes. It may put you at great risk for getting diabetes. Prediabetes is 100 to 125 mg/dl. Prevention. If you have received a diagnosis of prediabetes, here are few things you can do to delay or prevent type 2 diabetes. Get at least 40 minutes per day aerobic exercise like walking or cycling. Cut saturated and trans fat along with refined carbohydrates out of your diet. Eat more fruits, vegetables and whole grain. Eat small portions. Try to lose 5% to 7% of your body weight if you have overweight or obesity. We know different types of diabetes. Now let us know its symptoms. You may need testing if you have symptoms of diabetes such as increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that do not heal, poor muscle strength, dry itchy skin and numbness or tingling in the feet. Test for diabetes. Fasting plasma glucose FPG test, which measures your blood sugar at single point in time. You need to fast, not eat or drink for at least 8 hours before the test. The result of the test are given in mg/dl, milligram per deciliter. A normal level is 99 or below. Pre-diabetes is 100 to 125. Type 2 diabetes is 126 and above. HbA1c test, which measures your average blood sugar over the past 3 months. The result of a HbA1c test are given as percentage. The higher the percentage, the higher your blood sugar levels have been. A normal level is below 5.7 percentage. Pre-diabetes is between 5.7 percentage to 6.4 percentage. Type 2 diabetes is above 6.5 percentage. Oral glucose tolerance test. This requires fasting before this test. Random blood sugar test. This test can be taken at any time. No fasting is required. How do the food you eat affect your blood glucose level? The glucose in your blood comes from certain food called carbohydrates. Foods that are high in carbohydrates include candy, sweets, sodas, bread and white rice. The more carbohydrates you eat, the higher your blood glucose level will be. What food should you eat if you have diabetes? Fruits and vegetables, whole grains such as whole wheat, brown rice, barley and oats, proteins such as lean meats, chicken, turkey, fish, eggs, nuts, beans, lentils and paneer, normal or low-fat dairies such as milk, yogurt and cheese. What food should you limit to control your food? High-calorie food and drinks such as sugary food such as candy, cookies, cake, ice cream, sweetened cereals and canned fruits with added sugars. Drinks with added sugars such as juice, regular soda and regular energy drinks. White rice, bread and pasta, especially those made with white flour. Starchy vegetables such as white potatoes, corn and peas. Fried food and often other food high in saturated trans fat. Food high in sodium like salt, alcohol. If you do drink, you should drink moderately. Prevention of diabetes. If you have these following symptoms like heart disease, heart attack and stroke, neuropathy, nephropathy and retinopathy and vision loss, hearing loss, food damage such as infection and sores that do not heal, skin conditions such as bacterial and fungal infection, depression. Then consult a doctor and take medications. Don't worry, be happy. Stay tuned for more videos. Like, share and subscribe.